My friends, I want you to stop whatever you're doing right now and give me just the next few minutes, because what I'm about to share with you today could genuinely change your financial life. I'm not saying that to scare you. I'm not saying it to get your attention for nothing. I'm saying it because right now, in March of 2026, there is something happening in Washington, D.C. that every single person on SSI, SSDI, Social Security retirement, or VA benefits absolutely needs to know about. And far too many people, millions of hardworking Americans who have paid into this system their whole lives, are going to miss it simply because nobody sat down and explained it to them in plain English. So that's exactly what we're going to do today, you and me, right here, just like two old friends sitting across the kitchen table on a Tuesday morning with a cup of coffee. No confusing government language, no fine print buried in a 200-page report, just the truth about what's happening, what it means for your check, and what you can do about it starting today. Here's the headline. Congress is actively pushing for an $8,000 increase to SSI, that's Supplemental Security Income. And the conversation on Capitol Hill is getting louder by the week. Now, I know what some of you are thinking. You've heard promises before. You've been told things were coming, and then watched them disappear into the noise of politics. I understand that frustration deeply. But today, I want to walk you through exactly what's being proposed, where it stands, what's already been confirmed for March 2026 payments, and most importantly, how you can position yourself to get every single dollar you are legally owed. Let's start with what we know for certain right now, and then we'll get into the big legislative news. As of March 2026, the official federal SSI benefit rate, following the 2.5% cost of living adjustment that took effect in January, sits at $967 per month for an individual and $1,450 per month for a couple. Now, for context, the federal poverty line for a single adult in 2026 is sitting around $100 to $340 per month. So let's be honest with each other, $967 does not come close to covering what it costs to live in this country right now. Rent, groceries, medications, utilities. The math simply does not add up for millions of Americans who depend on SSI as their primary income. And that's exactly the argument that advocates and a growing number of lawmakers in Congress are making out loud. Here's the proposal that has so many people talking. A bipartisan group of senators and representatives, and yes, I said bipartisan because both sides of the aisle have members signed on, have introduced legislation that would raise the maximum SSI benefit to approximately $1,400 per month for individuals, with some versions of the bill calling for even higher adjustments in subsequent years that could bring cumulative increases close to that $8,000 annual figure you saw in the title. In other words, they are not just talking about a one-time boost. They are talking about structurally reforming SSI so that benefits are permanently tied to 100% of the federal poverty level and automatically adjusted to stay there. If that passes, some recipients could see their monthly checks go up by $400 to $500 every single month. Over a full year, that's exactly where you get to that $8,000 number. And some projections show it could be even higher for certain recipients when state supplements are factored in. Now, let me tell you about Dorothy. Dorothy is 71 years old, lives in a one-bedroom apartment in Ohio, and has been on SSI for the past 9 years after a back injury prevented her from continuing to work. Every month, Dorothy gets $967 from the federal government, and her state adds a small supplement, bringing her total to about $1,020. She spends $750 on rent, which leaves her roughly $270 for everything else: food, medications, transportation, and anything unexpected. Dorothy told me she sometimes has to choose between her blood pressure medication and buying enough food to last the full month. She is not unusual. She represents millions of Americans, and she is exactly the person this legislation is designed to help. If this bill passes, Dorothy could be looking at an extra $400 or more each month. That changes everything for someone like her. Now let's talk about what's already locked in for March 2026 payments, because I don't want anyone to miss their money. If you receive SSI, your March 2026 payment was actually issued on Friday, February 28th. The reason for that is because March 1st fell on a Sunday, and Social Security always pays early when the scheduled date lands on a weekend or federal holiday. If you did not see that deposit hit your account, please call the Social Security Administration immediately at 1-800-772-1213 or log into your My Social Security account at ssa.gov to check your payment status. Do not wait. Do not assume it will show up late. Contact them right away. For SSDI recipients, that's Social Security Disability Insurance, Your March payment schedule depends on your birthday. If your birthday falls on the 1st through the 10th of any month, your payment arrives on the second Wednesday, which in March 2026 was March 11th. If your birthday falls between the 11th and the 20th, your payment comes on the third Wednesday, which was March 18th. And if your birthday falls between the 21st and the 31st, you receive your payment on the fourth Wednesday, which is March 25th. Write those dates down, put them in your phone. You've earned that money and you deserve to know exactly when it's arriving. For Social Security retirement benefits, the same birthday-based schedule applies. And if you've been receiving benefits since before May 1997, all of your payments come on the third of the month, regardless of your birthday. Now, I want to spend a moment talking about VA benefits because our veterans deserve special attention in this conversation. VA disability compensation payments for March 2026 were also issued on March 1st. If you are a veteran receiving both VA compensation and Social Security, it is absolutely critical that you understand how these two benefit streams interact, because there are rules about concurrent receipt that could be affecting how much you actually take home every month. Most veterans receiving both VA disability and SSDI are fine. Those two programs do not offset each other, and you should be receiving the full amount from both. However, if you are receiving a VA pension, which is different from disability compensation, and also receiving SSI, those benefits can affect each other, and you may be leaving money on the table if you haven't had a benefits counselor review your situation recently. I strongly recommend calling your nearest Veterans Service organization, whether that's the DAV, the VFW, the American Legion, or any other VSO, and asking them to do a full benefits review at no charge to you. Let me also talk about something that doesn't get discussed nearly enough. And that's the hidden bonuses and little-known credits that many seniors and disabled Americans simply don't know they're entitled to. First, if you are on SSI and you have not checked your state's supplement program recently, please do so today. States like California, New York, Massachusetts, and Connecticut add substantial amounts on top of the federal SSI benefit. California's state supplement alone can bring your total close to $1,200 per month for an individual. If you move to a different state in the last year and haven't updated your address with Social Security, you could be missing your state supplement entirely. Second, the SNAP connection. If you receive SSI, in most states you are automatically eligible for SNAP food assistance. That's what used to be called food stamps. The average SNAP benefit for a senior living alone is around $120 to $180 per month in 2026. That's real grocery money. If you are on SSI and not receiving SNAP, call your local Department of Social Services and apply. It takes about 30 minutes and could mean an extra $100 in food every single month. Third, and this is the one I really want you to pay attention to, the Extra Help Program for Medicare prescription drug costs. If your income is below roughly $22,000 per year as a single person, you may qualify for extra help, which can reduce your prescription drug costs to almost nothing. In 2026, that means paying no more than about $4.50 for each generic drug and $11.20 for each brand name drug, with no coverage gap. If you are paying more than that at the pharmacy, you need to apply for extra help right now. You can apply through Social Security at ssa.gov or by calling 1-800-772-1213. Now, let's come back to taxes for a moment, because this is an area where I see seniors make costly mistakes every single year. SSI benefits are never taxable, not a penny. If someone is telling you that your SSI is subject to federal income tax, they are wrong. Social Security retirement and SSDI, however, can be partially taxable depending on your combined income. Here's the simplified version. If your total income, counting half of your Social Security benefit plus all your other income, is between $25,000 and $34,000 for a single filer, up to 50% of your Social Security may be taxable. If that combined income goes above $34,000, up to 85% may be taxable. Now, this does not mean you pay taxes on 85% of your benefit. It means up to 85% of it is included in your taxable income. For most people in lower income brackets, the actual tax owed is quite small or nothing at all. But please, if you are uncertain, sit down with a free tax preparer through the AARP Tax Aid Program before the April filing deadline. They specialize in exactly this situation, and their services cost you nothing. Now, let me come back to the big legislative picture, because I want to be honest with you about where things stand. The bill to raise SSI to 100% of the federal poverty line has passed out of committee and is now being debated on the floor. Advocates are cautiously optimistic, but there is genuine opposition, primarily around the cost, which the Congressional Budget Office has estimated at roughly $490 billion over 10 years. Supporters of the bill argue that this cost must be measured against the human cost of keeping millions of elderly and disabled Americans in poverty. The debate is real, and the outcome is genuinely uncertain. What I can tell you is that the advocacy community, including AARP, the National Council on Disability, and dozens of disability rights organizations, is pushing harder than they have in years. They are making phone calls, they are sending letters, and I want to encourage you to do the same. Call your senator, call your representative. It takes 5 minutes, and it makes a real difference. You can find your elected officials by entering your zip code at congress.gov. Here's something I want to leave you with today, my friends, because I think it matters more than any dollar figure. You spent your life working, you paid into this system, you raised families, you built communities, you served your country. The idea that you should have to choose between your medication and your groceries is not a personal failure. It is a policy failure. And the good news is that policy can change. People in Washington are listening right now in March of 2026 in a way they haven't in a very long time. The conversation about raising SSI is not going away. The momentum is real. In the meantime, please make sure you are getting everything you've already earned. Check your payment dates. Apply for SNAP if you haven't. Look into extra help for prescriptions. Get a benefits review if you're a veteran. And if anything in your financial or health situation has changed recently, a hospitalization, a move, a change in income, report it to Social Security right away, because unreported changes can lead to overpayments that you'll be asked to pay back later, and nobody needs that stress. If this video helped you today, I want you to share it with one person, a neighbor, a family member, a friend at church or at the senior center, who you think might need to hear this. Because sometimes the most important thing we can do for each other is simply make sure no one gets left behind. I'll be back with another update as soon as there is more news on the SSI legislation and the April payment schedule. Until then, take care of yourself. You matter, your benefits matter, and I will see you in the next video.